Welcome to Cancer Lesson 5.4, What Happens After Cancer is Treated. The goals of this lesson are to reiterate the role of cancer resistance in treatment and to explore alternative cancer therapies. At the end of the lesson, the students should be able to define the terms remission and relapse and explain how the potential for relapse influences the choice of treatment. Explain why different cancers respond to similar treatments differently, and explain the purpose of palliative and alternative therapies and when they are appropriate. We will achieve these goals by examining case studies of patients 1, 5, and 10 years after treatment. To prepare for this lesson, you'll need to review the following key scientific concepts that will be presented throughout the lesson. Cancer treatments that target one area, such as surgery or radiation, will not eliminate cancer cells that have migrated out of that area. Most treatments do not eliminate all cancer cells. This leaves a chance of cancer recurrence. Cancer is an evolving disease, and cancer drug resistance, like antibiotic resistance, is a major barrier to curing cancer. Remission means that there is an absence of symptoms. It does not necessarily mean that cancer has been cured. 5 years of remission is considered clinically important because the chances of cancer recurring are significantly reduced. You can review this scientific content in the background reading provided for you in the teacher primer, the teacher manual, and the student workbook. The teacher primer provides in-depth knowledge about the scientific content presented in this lesson. The teacher manual or lesson plan provides a minute-by-minute explanation of the lesson structure, and the student workbook provides additional explanation for students. Be sure to print the lesson worksheet and the homework worksheet. The key points of the do now are that cancer constantly evolves, much like bacteria randomly evolve to be resistant to antibiotics. Cancer drugs do not induce drug resistance, they merely select for the cells that already have randomly acquired the mutation. Remission entails the absence of symptoms, not necessarily the absence of cancer, and recurrence is the reappearance of symptoms. In the previous lesson, students discussed 3 treatment strategies for cancer and evaluated treatment plans for 4 patients. Now we will examine the outcomes of those 4 patients after treatment. But first, what happens after treatment? Generally, if most of the cancer cells have been killed, the patient will go into remission, which means the disappearance of all symptoms. However, sometimes not all cancer cells can be killed, and eventually the cancer can return, causing new symptoms. This is called recurrence. Why would recurrence happen? To answer this question, we review what happens when tumors are treated with radiation. The tumor will shrink. Often, radiation is not enough, and in order to kill the other cancer cells that still survive, chemotherapy is needed. In the activity, students will evaluate the outcomes of their patients 1, 5, and 10 years after treatment. They will assess whether they would have changed their treatment plans if they knew what became of their patient. The activity will also introduce students to other forms of therapy, including palliative therapy. This occurs at the beginning of cancer diagnosis, irrespective of what the expected outcome of the patient is. Sometimes palliative therapy can involve alternative approaches to medicine. The therapies we discuss in the activity will expose students to a part of medicine that goes beyond the core cancer diagnosis, including spiritual and psychiatric therapies, diets that may help promote the immune system, but which should not be considered curative, and finally, end-of-life care for patients who cannot be cured with current treatments, but who can live their final days with as little suffering as possible. The key points of the wrap-up are that after a patient gets diagnosed, the primary therapy is disease-modifying therapy, treatment that targets the disease with the goal of curing it. As time progresses, palliative care increases while disease-modifying therapy decreases. Eventually, the emphasis in treatment is on end-of-life care. The wrap-up provides an overview of the types of therapies discussed in this lesson. This leads us to the question, can we avoid cancer altogether? Students should consider all the factors that contribute to cancer risk. For homework, students should watch the 60 Minutes piece entitled The Cost of Living and answer questions about the healthcare system and the rising cost of end-of-life care. One of the most common questions students ask is cancer drug resistance like antibiotic resistance? Exactly. When a polyclonal tumor is exposed to a drug, the cells that have acquired mutations to the tumor will not be killed, just like bacteria who have acquired mutations to resist an antibiotic. Remember, the mutations exist before the drug is given. The drug does not induce the mutations to occur. All it does is select for cells that already have those mutations. Another question students ask is there any difference between cancer drug resistance and antibiotic resistance? Yes, one difference is that antibiotic resistance is found on a plasmid that can be passed from cell to cell. Bacteria won't be resistant unless they have the plasmid. In contrast, chemotherapy resistance is integral to the cell genome and therefore can be passed on to all descendants of the resistant cell. At the end of the lesson, collect the lesson worksheets to assess students' explanations of why different cancers respond to similar treatments differently. This lesson provides a real-world example of why understanding the mechanism of cancer progression is important when considering the progression of cancer treatments. Don't forget, if you have any questions, concerns, or feedback, to let us know. You can contact any of the CTSE team members and we'll be happy to help you.